Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. The theme of our health talk today is dense breast and high risk screening. Today we are going to talk about something many women hear about the mammogram but do not always understand what it shows, a dense breast tissue. Joining us today is my guest speaker, Dr. Carolyn Snetter, a board certified breast surgical oncologist, and she is going to highlight about this issue among our women. Thank you very much, Carolyn, and thanks for joining me today.
It's a pleasure to be here again. Thank you so much for having me.
Yes, it is always nice to have you here. The last time you were here, first segment, and you did a wonderful job.
Thank you.
So just a brief introduction about yourself.
So I am board certified in general surgery and did special training in breast surgical oncology. So my practice primarily focuses on solely women with benign or malignant breast disease. So that's the majority of my practice, and I truly enjoy it.
You must be really busy. This common issue, main topic everywhere, right?
Yeah.
So you must be really busy. So basically, what is the dense breast tissue for our viewers should know? Can you tell them
Yeah, definitely. So, and I think, dense breast tissue and, high risk patients, it doesn't necessarily mean that you're high risk if you have dense breast tissue, but I think it's a very important topic because there's a lot of misconceptions about it. So basically, dense breast tissue is determined on your mammogram. It's not necessarily how your breasts feel on clinical exam. And actually, about 40 to 50% of women have dense breast tissue. It doesn't necessarily mean that those patients are going to get breast cancer. So I think that's one big misconception.
One question, Carrie, does that dense breast, is it more linked to the obesity, or it doesn't matter the weight?
No, I don't think there's a strong correlation between the two.
Okay.
I think with age, we tend to see more dense breast tissue in premenopausal women, and as women go through menopause, that dense breast tissue gets replaced with more fatty tissue.
It becomes more fatty.
Yeah.
Okay. So when we send them, I see them in my office practice, wherever I'm working, urgent care or ER. When I see them, something like doesn't seem normal when I palpate them, I send it to you. Of course, when they go to your office, what do they expect? Of course, mammogram will be there.
So one of the things, if patients are coming to my clinic to first, I'll say if they're concerned about dense breast tissue, I'll go through what does that actually mean, and I have a good visual representation on this next slide here that I'd like to show patients. So
sure.
First, I want patients to understand what does it mean. So there's 4 categories of breast tissue and how we put it, how we define it in terms of how dense breast tissue is. So if you take a look at the slide on the far left, the first category is primarily fatty breast tissue.
Right, yeah. More yellowish.
Yep, absolutely. And then the second category is fibroglandular densities, where you can just see some of the pink area. That's just kind of scattered areas of more of that dense breast tissue, but there's still like a good component of fatty breast tissue. And then women who have heterogeneously dense breast tissue, that's that third picture over from the left. I like to think of it, it's kind of an even mix throughout the breast between dense breast tissue and then fatty breast tissue.
Yeah.
And then the last category of dense breast tissue is extremely dense. And you can see from this visualization, the pink representing the breast tissue or breast parenchyma, how much that encompasses the breast, where there's very little fat. So I like to go through and explain to patients what is their density and then what does that mean for them.
So first of all, they will have a mammogram, and then you will go through. And like you said, one question I wanted to ask you, Carrie, from my background is pediatrics also. So if somebody, like an adolescent, do you take them? Do you consider them? What age group?
Yeah, I'm honestly, any patient that has a concern, or if a provider has a question and wants me to review.
You will review.
Yeah, absolutely. I think for patients that have dense breast tissue, why is it so important to understand what that means and to look at their screening mammogram? I have a good picture on the next slide here that will show, if you can see on the far left, see how it looks more, the breast tissue looks more dark. And as we move, and then as we move to the far right, it looks very white. So density is so important because breast cancer can present as either like a mass or calcification that show up white on mammogram. And so when patients have that very dense breast tissue, as we move to when you move to the right, there's concern that,
something is not right.
Right, but there could be a cancer or calcifications kind of hiding behind or masked by that dense breast tissue.
So are you able to kind of spot that calcification if there is any?
So that's the whole.
Then you do the high density.
Yeah. So I think the whole dilemma is, is there the potential for something to be missed, and you might not necessarily be able to spot in patients that have the extremely dense breast tissue.
That is true.
One of the things that we do in the United States, they came out with this Mammography Quality Standard Act, and basically that requires by law any mammogram center to send letters to patients to say, this is what your breast density is.
Looks like,
Yes, and so I think it's very important for patients to understand that, and it's fantastic that we do this now so patients know, what is your breast density.
Yeah. So as soon as even if it is a suspicious of calcification or something, it should be brought attention to the to the patient, because they have to know what it is, right?
Right, absolutely.
Okay.
And I think so one thing that I get asked when patients come in, if I get referred a patient that's concerned that they have, dense breast tissue, we look at the mammogram.
Yeah.
I want patients to know that just because you have dense breast tissue doesn't mean you necessarily are going to get breast cancer. So what's important to note is figuring out, what patients should we recommend supplemental screening to?
Exactly.
In addition to mammogram.
Yeah, exactly. So now one question, like in my practice, I have seen so many, all these years of clinical practice, major hospitals. Some come with a breast mass. We have a mammogram, and basically the radiologist, not a specialist like you, but the radiologist will say, well, it seems normal. But 6 months later, they come with a big mass, and they have all signs of malignancy.
Right.
So
I actually had a patient in my clinic the other day, very similar story, had a completely normal benign mammogram 5 or 6 months ago, and then had presented with a very large breast mass. So I think for patients, one of the things I like to stress is to listen to yourself and seek
Yeah.
care from a provider or a breast specialist to have a clinical exam, because those patients, even if something wasn't picked up on mammogram,
Right. Yeah. They can.
there could be something that was potentially hiding.
Something else.
Yeah.
Exactly. Yeah.
I think I have a picture on the next slide that I want to show
Okay.
you and your
Sure.
viewers.
Okay.
So this is a good representation of that. So on the left, that is, again, patients with fatty breast tissue.
Yeah.
And you can see in the center, there's this kind of white little spiculated
Right.
mass with the circle around it. And it's very easy to visualize that that is breast cancer. So it's a lot easier to see on mammogram for these patients because of the fatty tissue surrounding it isn't hiding it.
Right. It's a hiding.
Right. And then on the right-hand side, you can see kind of the white area, the majority of the breast, that white is that dense breast tissue, but hiding up on the top view, that circle, is a breast cancer hiding underneath. So you can see sometimes patients might have a normal screening mammogram, but that density really plays a key role, and could there be something underlying that might need additional imaging?
Yeah, so those kind of things is very suspicious, this other slide. Now, I had a close relatives, everything was normal, but then several months later, I started having some nipple discharge.
Oh, geez.
So would you comment about, I know that is a, carcinoma involving the ductal ducts, so can you comment on those kind of
Yeah, I think
carcinoma?
Yeah, so I think that definitely dovetails into if
Okay.
you had a normal mammogram, but you have clinical symptoms. So
Yeah.
bloody nipple discharge
Yeah.
coming from one side, clear nipple discharge, feeling a mass, all things that are not normal for a patient's baseline.
Right,
To,
right.
to seek evaluation from a provider or a breast
Right.
specialist, because those patients might require additional imaging and workup,
Right.
even though their mammogram might have been normal.
Yeah. So, because those are the things that needs to be, and those are the red flags
Yes.
of diagnosis, right? You miss just little things, and then later on the symptoms are flare-ups.
Right. Absolutely. Yeah, I think you said it perfectly. Red flags.
Red flags, yeah.
Yep. Those are the things that, should trigger you to say, I should seek evaluation from somebody to make, from your PCP, your OB-GYN, your internal medicine physician, your family medicine
Right.
physician, or, a breast specialist.
Yeah, so that is the most important thing.
Yeah.
Because, when I teach my student residents, I always emphasize a good physical examination. Remember the ABC of emergency medicine or textbook, in any textbook, a good history,
Yes.
a good thorough physical evaluation, and then order the diagnostic.
Yes. Yeah. One of my greatest mentors from my training, he always instilled that a physical exam trumps any, diagnostic test.
Right,
Not
yeah.
all the fancy advances that we have. A good quality physical exam
Yeah.
doesn't replace it. The technology that we have complements it.
Yeah, I don't know. I don't know too much about this whole situation now. I know more and more about the fatty breast tissue. But would you comment anything about the hereditary aspects of these masses?
Yeah, so in terms of like genetics impacting whether or not a patient has dense breast tissue, I think I can't give you an exact number, but yes, I think
Genetics.
I think genetics definitely play a component in it.
Yeah.
So one of the things, if I have a patient coming to my clinic and the patient's told, they have dense breast tissue, and then we're trying to figure out, what type of supplemental screening do they need?
Right.
So the two major supplemental screening modalities that we use for women with dense breast tissue is a breast MRI
Yeah.
or something called an automated breast ultrasound.
Okay.
And whether or not who gets what test is very individualized. And so what I'll do with patients is figure out what is their lifetime risk of developing breast cancer.
Like their lifestyle. Are they multi-gravida or do they have
Yes.
multi-partners and those kind of things, right?
Right, absolutely. So we use or at least in my practice, there's several validated models that are used to determine what a woman's lifetime risk is. The two models that I use, one is this Tyrer-Kruzik model and the other is the Gale model. And these models take into account, like what you just said, how many pregnancies has the patient had,
Right.
what was their age at their first pregnancy, what's the family history, is there a family history of breast cancer, any history of genetic mutations, and multiple other factors where we come up with this calculation to say, are you high risk? Should you be getting supplemental screening, especially in the setting if the patient has dense breast tissue? And so in my practice, patients that are greater than a 20% lifetime risk, that's when I sit down and say, should we get supplemental screening? And what is going to be the appropriate one for what patient?
Okay, so this is what, you will be advising those patients, which is so very important, like a multi-gravida, many pregnancy, lactation.
Yes.
They are more susceptible to have more breast tissue. So ultrasound and then do you do any kind of dye injection and to go further?
So for the MRI,
MRI, yeah.
that one we'll do one with some contrast, some dye, and then one without to get a
Yeah.
better view of the breast. The ultrasound, we don't need to do that.
Right.
Patients who gets what? If someone is recommended to have supplemental screening, patients that do have dense breast tissue but aren't considered technically high risk, that greater than 20% lifetime risk, they may be better suited for the automated breast ultrasound.
Yeah.
Whereas women that have greater than a 20% lifetime risk, so higher risk, strong family history, they may be better suited for a breast MRI.
Okay. That MRI will be with the dye injection and all that, right?
Yes.
So you can localize exactly like what it is, where is the...
Yes, and so what's so good about MRI is that it is like 98 to 90% specific and sensitive for picking up masses
Like that.
Yes, that would have been
Right.
hidden on the mammogram. The thing is that I always have this discussion with patients. I kind of call it a double-edged sword, that it's so good at picking up masses that could be obscured or hidden on mammogram, but it also is so good at picking up probably benign or non-cancerous lesions.
Oh, okay, yeah.
So I counsel patients that when we get the breast MRI, it could lead patients down the path of getting benign breast biopsies that might
Right,
lead to a
yeah.
non-cancerous result.
Yeah.
So that's why I think it's so important to choose which one, because patients that don't have a really high risk, lifetime risk, they might be better suited for that ultrasound. Whereas patients I know that have a high risk,
Yeah.
we might have a better yield with the breast MRI.
Okay. So this is for our viewers to know that it is very important to see you, so you can decide whether it is just a simple
like ultrasound
or with I'm telling you, I feel so miserable because I have a very close relative and daughter is suffering for stage 3, stage 2 cancer. Now I know you won't. We cannot talk too much about the treatment protocol, but I just attended the meeting at Drake Hotel in International Drive about the carcinoma in general, cancer of the breast, cancer of the liver.
Oh, yeah.
Sicklers. Oh my God, this was. And I felt like I don't know anything. Things have changed in life. Yeah, so much now.
And I feel like things are rapidly advancing.
Yeah, rapid advancing.
So many advances
Yeah.
in the past 10 or 15 years that
Yeah.
it is hard to keep up on.
I know.
So
And they were all, the speakers were all like you, young, vibrant, and they're showing, that the most advanced things that is being done, for
Yeah.
this. And so I don't know where will this end? This whole modern science.
I don't think it will. It'd be great to have a crystal ball in life, but yeah, I just think things are going to continue to advance, and it will only be an advantage for the patient.
Right, yeah. Hopefully, this will be all for the good of our patient, right?
Yes.
Overall, early diagnosis, with all these means, and early treatment, and also, Kerry, there were so many new treatment regime that is going on, experimental drugs.
Absolutely, it's
Yeah.
impressive the volume of things that have been
Yeah.
coming out recently. Again,
Pfizer have come up with so many, NIH have approved some drugs, and it
Yeah.
was interesting. I was very amazed to see, all those people talking about all these recent advances.
Yeah.
Probably next time, let us, you and me, go together.
Yes.
To one of them.
We'll
They
keep
have
each
it
other
in
on
February.
track. Yeah.
They have it in February, so let us plan and we can
I
go
like it.
together.
Put it on my calendar.
Yeah, put it on the calendar. So, what is the most important message you want your viewers, our viewers to know?
Yeah,
Keynote advice.
I think the most important thing that I want to stress and emphasize to patients is that MRI does not replace mammogram.
Okay.
MRI is not as good as a mammogram in picking up calcifications.
Right.
It's used in addition to. So for patients, I always recommend annual screening mammograms. And if you're recommended to have supplemental screening, MRI or ABIS, that automated breast ultrasound, that's in addition to mammogram.
Yeah.
So
there should be.
always get it.
So that's good. On behalf of our Health Talk board, everybody, I'd like to thank you for coming to my Health Talk today. And for our viewers to know, this is the second segment of the Health Talk with Dr. Schumer. And anybody interested, they can always, they have an access to the slides
Yes.
presentation
Great.
in YouTube and also in Vimeo.
Perfect.
So you can see all the slides. I'd like to thank our producer for helping me produce this, and I want to wish you a very happy Merry Christmas.
You too.
Yeah,
I
and
really
Happy
appreciate
New
it.
Year.
Thank
Yeah.
you. Thank you so much for having me again.
Thank you so much. Yeah, thank you.